A colonoscopy test lets your doctor see the inside lining of the colon and rectum. The colon is also called the large intestine or bowel. In this video, you'll learn what to expect during and after the test. Before you have your colonoscopy, you'll need to completely empty and clean out your colon. Preparing for the test takes 5 days. To learn more about the process, watch the next video in this series at MyHealth.Alberta.ca/colonoscopy. On the day of your appointment, be sure to arrive on time and have your Alberta healthcare card with you. Expect to be at the clinic for 1.5 to 3 hours. Plan ahead to have someone take you home after your test. You won't be able to drive because of the sedation medicine used during the colonoscopy. Even if you don't plan to have sedation, you should still arrange for someone to pick you up in case you change your mind during the test. When you arrive at the clinic, check in at the front desk. You'll be asked for the name and phone number of the person who'll be driving you home and your medical history, if you're allergic to anything, and what medicines and supplements you take. You'll also be asked about the last time you ate and drank. Once you're taken to your assigned bed, you'll change into a hospital gown. The nurse will check your breathing, blood pressure, temperature, and heart rate. An intravenous line or IV will be started in your hand or arm. An IV is a small flexible tube that's inserted with a needle into your vein to give you fluids or medicines. You might feel a slight pinch or sting for a few seconds when it's inserted. When it's your turn, you'll be brought to the procedure room. Along with the doctor, 1 or 2 nurses will be with you for your test. Sedation medicine is usually offered at the beginning of the test to make you comfortable and help you relax. If you choose to have sedation, it will be given through your IV. The sedation medicine will make you feel sleepy. You'll still be able to breathe on your own, but the nurse will place a small oxygen tube into your nose. Most people remain aware of what's happening but may forget some of the details of the test. Some people choose to have the test with no sedation. If you have questions about whether sedation is right for you, talk to your nurse or doctor. The colonoscopy test begins with a rectal exam. Your doctor will gently insert a lubricated, gloved finger into the rectum. This is to check if anything feels abnormal. Your doctor will then insert the colonoscope into the rectum. It will be moved slowly all the way through the colon. The colonoscope has a light and camera on the end. Your doctor can see images on a screen and take pictures as they move it through the colon. The colonoscope has openings where water, air, and instruments can pass through. To help your doctor see, air will be pumped in to keep your colon inflated. Because of this, you may feel some cramps, bloating, or pressure. If anything abnormal is found during the test, it may be removed with a small tool in the colonoscope. There are no pain receptors in the bowel, so this should not hurt. When a polyp or tissue sample is taken, it is sent to the lab for testing. The entire test takes about 20 to 45 minutes. If you have any concerns about what will happen during the test, talk to your doctor or healthcare provider. Adjustments can be made so you feel comfortable and safe during your colonoscopy. After your colonoscopy, you'll be taken to a recovery area to rest. If you've had sedation medicine, it can take 30 to 60 minutes for the effects to start wearing off. During your recovery, the nurses will continue to monitor your breathing, blood pressure, temperature, and heart rate. You'll be encouraged to pass gas to help relieve any pressure caused by the air in your colon. If a tissue sample was taken, it's normal to see a small amount of blood on the toilet paper when you go to the bathroom. Before you leave the clinic, information about your test and future care will be shared with you. The person who'll be taking you home will need to come into the clinic to pick you up. It's also okay to take public transportation, but you need to have someone with you to make sure you get home okay. Anyone who receives sedation medicine is considered to be impaired. For this reason, there are several activities you can't do for at least 8 hours. Don't drive, operate heavy machinery, or take part in hazardous activities. Avoid all alcohol. Don't make any major decisions or sign any legal or financial documents. If you need to care for young children, have another adult stay with you. If you have sleep apnea and use a machine to help you breathe while sleeping, be sure to wear it, even for naps, for the first 24 hours after your test. After the test, you can start to eat and take your medicines as usual, unless told otherwise by your doctor or healthcare provider. Be sure to rest and avoid any hard exercise or heavy lifting. You can go back to your usual routine the day after your test. Although complications are rare, they can happen up to 4 weeks after your colonoscopy. Get medical help if you're passing a lot of blood from your rectum, feeling faint, have a fever, or belly pain that doesn't get better after passing gas. Be sure to tell the healthcare team that you've had a colonoscopy. It's also not recommended to travel within 2 weeks of your colonoscopy. Never ignore new symptoms, including blood in your stool, a change in your bowel habits, belly pain, or unexplained weight loss. Be sure to see your doctor to find out the cause. For more information, visit MyHealth.Ca/colonoscopy and watch the other videos in this series.